Today we're going to be talking about the deltoid and in particular anterior section. The origination for the anterior section is going to be on the lateral 1/3 of the clavicle, and then the insertion point is going to be on the deltoid tuberosity of the humerus. The action of the deltoid of the anterior aspect is going to be flexion of the shoulder, adduction, as well as lateral rotation. You can palpate it in here. To do the manual muscle test, we're going to place the patient in this position right here. We're going to stabilize at the shoulder, get our long lever here, and I'm going to push down and back. Hold for 5 seconds. Ready, go. 1, 2, 3, 4, 5, relax. This patient received a 5 out of 5 for the manual muscle test. Today we're going to be talking about the deltoid, and in particular the middle part. The origin point for the middle deltoid is going to be on the lateral part of the acromion in here, and the insertion point is going to be on the deltoid tuberosity of the humerus in here. Muscle belly is going to be right here. The primary action of the deltoid middle aspect is going to be abduction. To do this manual muscle test, you can either place the patient's arm in a fully extended. For this one, we're going to do it like this. You'll get your anchor point here and your long lever here, and I'm going to push into adduction. Hold for 5 seconds. Ready, go. 1, 2, 3, 4, 5, relax. This patient received a 5 out of 5. Today we'll be talking about the deltoid and in particular the posterior aspect. The origin point for the posterior deltoid is going to be on the spine of the scapula, and then it's going to come down to the deltoid tuberosity of the humerus. You can feel the muscle belly in here. The primary functions of this muscle is going to be extension of the shoulder, horizontal abduction, as well as external rotation. To perform the manual muscle test, you're going to place the patient in this position. I'm going to stabilize at the scapula, and then I'm going to hold here, and I'm going to push down and out a little bit. Hold for 5 seconds. Ready, go. 1, 2, 3, 4, 5, relax. This patient will receive a 5 out of 5 for this manual muscle test. We'll now be talking about the latimus dorsi. The origin point for the latimus dorsi is on the thoracocolumnar aponeurosis, as well as T7 to the iliac crest. And then the insertion point is going to be on the bicipital groove. The body of the muscle is going to be here, comes under to insert onto the bicipital groove. The primary action of this muscle is going to be internal rotation, adduction, as well as extension. To perform this manual muscle test, you're going to put the arm into this position with the palm facing in, stabilize on the hip, and instruct the patient. You're going to hold for 5 seconds. Ready, go. 1, 2, 3, 4, 5. Relax. This patient will receive a 5 out of 5 on this manual muscle. We'll now be talking about the teres major. The origin point for this muscle is going to be on the inferior angle of the scapula, as well as the lower 1/3 of the axillary border, and it's going to go to the medial aspect of the bicipital groove. You can palpate it into here. The primary function of this muscle is going to be external extension, internal rotation, and adduction. To perform this manual muscle test, you're going to place the patient and you're going to tell them, put your hand in your opposite back pocket like this. You're going to have them elevated off their backs to make sure there's space in between. You're going to stabilize. I'm going to hold here and push down to his back. Hold 5 seconds. Ready, go. 1, 2, 3, 4, 5, relax. This patient will receive a 5 out of 5 on this manual muscle test.
Today we're doing serratus anterior. This muscle originates in the first 8 ribs, and then the muscle belly comes across and inserts in the vertebral border, scapula. Relax. And then the main action is going to be upward rotation and protraction of the scapula. So to test this, you're going to have the patient punch the ceiling. Put both your hands at the top. You're going to push down for 5 seconds. Ready? 1, 2, 3, 4, 5. Relax. Should be a 5 out of 5 manual muscle test. Alright, today we're doing trapezius. This has 3 parts: upper, middle, and lower. Upper is going to start on the occipital tuberance and come across to the acromion. The middle is going to come from ligamentum nuchae, come to the spine of the scapula. And then lower is going to come ligamentum nuchae, and then the lower portion of the spine of the scapula. The actions for these muscles are going to be, for the upper, it's going to be elevation and upper rotation. The middle is going to be retraction, and then the lower is going to be depression and upper rotation. So first, let's to do the manual muscle test for the lower fibers. I'm going to have them go in the Superman position, or come to the edge of the table, put the arm out here, thumb up. You're going to stabilize here at the scapula, and then you're going to try to push down and they hold for 5 seconds. Ready? 1, 2, 3, 4, 5. Relax. So that was for the uppers. That was for the lower. This is for the middle. Come straight out to 90. And then I'm going to try to push down and they hold. Ready? 1, 2, 3, 4, 5. Relax. And then for the upper, go for the short sit. You're going to have them bring the ear to the shoulder. And then I'm going to try to pull them apart. Ready? 1, 2, 3, 4, 5, and relax. Alright. Same way doing levator scapula and the rhomboids. To palpate, so the origin for the levator scapula is going to be the C1 to C4 here. And it's going to insert on the vertebral border of the scapula. And then the action is going to be elevation and downward rotation of the scapula. For the rhomboids, the origin is going to be C7 through T5 here. And then it's also going to insert on the vertebral border of the scapula. The action for this one is going to also be downward rotation, but also retraction. To do this manual muscle test, have the patient prone, with the arm hanging off the table, and have them extend the shoulder back and flex the elbow. You're going to stabilize here on the shoulder, and then push down into flexion. Ready? 1, 2, 3, 4, 5, and relax. That'll be a 5 out of 5.
So right now I'm going to be palpating and doing the manual muscle test for supraspinatus muscle. So it originates in the supraspinous fossa, which is above the spine of the scapula, which is right here. So it's right above it. And right now I'm palpating the muscle belly, and then it attaches at the greater tubercle of the humerus, and its action is abduction. Now the infraspinatus muscle originates at the infraspinous fossa, which is right under the spine of the scapula. So it's right under here, and I'm palpating the muscle belly now, and it comes around and attaches to the greater tubercle on the humerus as well. And the action of infraspinatus is external rotation. So for the manual muscle test, we'll do supraspinatus first. So I'm going to get you to stand and put your arms in 30 degrees abduction and hold for 5 seconds while I push in. Ready, go. 1, 2, 3, 4, 5, and relax. And for infraspinatus, you're going to put your arm out at 90 degrees, a little bit of abduction, and turn your arm so your palm is out. And I'm going to stabilize here and push down, so hold for 5 seconds. Ready, go. 1, 2, 3, 4, 5, and relax. And both of those were 5 out of 5. So I'm going to be palpating and doing the manual muscle test for teres minor. So it originates on the axillary border of the scapula. So that would be right here, and inserts at the, so right now I'm palpating the muscle belly, and inserts at the greater tubercle of the humerus. And its main action is external rotation. So for the manual muscle test, the patient is in prone position, and I'm going to pull her arm out into external rotation at 90 degrees, and I'm going to support the humerus and push on a long lever into internal rotation. So hold for 5. Ready, go. 1, 2, 3, 4, 5, and relax. And that was a 5 out. So I'm going to be talking about subscapularis, and it originates in the subscapular fossa. It's not palpable because it's on the anterior side of the scapula. So, but it does originate in the subscapular fossa, and it attaches to the lesser tubercle of the humerus. For the manual muscle test, well, its main action is internal rotation. So for the manual muscle test, the position is the patient's in prone position, and we're going to start with the humerus at 90 degrees and forearm at internal rotation, and you're going to support the humerus and push into external rotation. So hold for 5 seconds. Ready, go. 1, 2, 3, 4, 5, and relax. And that was a
We're
5
gonna be talking about the pec major muscle. The origin is going to be the medial half of the clavicle. It's going to, here's the muscle belly right here. It's going to insert on the lateral lip and the bicipital groove. And the actions are adduction, horizontal adduction, and internal rotation. And to do this manual muscle test, I'm gonna have the patient put their arm up. I'm gonna stabilize their shoulder, and we're gonna be pushing their arm pretty much diagonally. All right, ready? For 5 seconds. Ready, go. 1, 2, 3, 4, 5. Relax. And that patient will receive a 5 out of 5 for that manual muscle test. Okay, so the next muscle I'm gonna be talking about is the pec minor muscle, and the origin is gonna be on ribs 3 through 5. The insertion is gonna be the coracoid process. And the muscle belly would be inappropriate to palpate on this patient. The action is protraction, depression, and downward rotation of the scapula. And so this manual muscle test, I'm gonna have my patient raise her arm. And I'm gonna stabilize the opposite shoulder and just push this patient into abduction. All right, ready? 1 to 5 seconds, go. 1, 2, 3, 4, 5, relax. And she would receive a 5 out of 5 for this manual muscle test.
So the next muscle I'm going to be doing is the coracobrachialis muscle. The origin is the coracoid process, and the insertion is going to be the middle third of the medial humeral shaft. That's going to be right here. The muscle belly is going to be right here. See that? And the action is adduction and flexion. And for the manual muscle test, she's going to be in this position right here. We're going to stabilize the shoulder and push on 5 seconds. Are you ready? Go. 1, 2, 3, 4, 5. Relax. You should receive a 5 out of 5 for this manual muscle test. The last muscle I'm going to be doing is the biceps brachii muscle, and the short head is going to originate at the coracoid process, and the long head is going to originate at the supraclavian tubercle, which is not palpable. And the insertion point for this muscle is going to be at the radial tuberosity. The muscle belly is going to run along right here. And the actions for this muscle is supination of the forearm, flexion of the elbow, and the short head also flexes the shoulder. And so this manual muscle test, I'm going to put this patient into 90 degrees of elbow flexion, and she's going to hold that position while I push downward. Okay, ready? Go. 1, 2, 3, 4, 5. Relax. This patient will receive a 5 out of 5 for this test.